Healthcare fraud is among the most prevalent crimes in the United States. It has devastating effects on human lives, and the effect on the economy is colossal. Welcome to today's episode of Fraud Files. Today, we will be talking about the case of 36 individuals who were charged by the Justice Department with $1.2 billion in healthcare fraud. To get all the details in this story, make sure you watch till the end. And don't forget to hit the subscribe button to become part of this channel and click the bell icon to get notified of our subsequent videos. Let's get started. Criminal charges have been brought against a telemedicine company CEO, owners and executives of clinical laboratories, manufacturers of durable medical equipment, marketing firms, and medical personnel as part of a statewide coordinated law enforcement action. The department seized expensive cars, over $8 million in cash, and other fraud proceeds as part of the enforcement action. In addition, the Center for Payment Integrity, CPI, at the Centers for Medicare and Medicaid Services, CMS, said today that it had taken administrative measures against 52 providers who had participated in similar fraud. The Department of Justice is committed to prosecuting people who abuse our healthcare system and exploit telemedicine technologies in fraud and bribery schemes, said Assistant Attorney General Kenneth A. Polite Jr. of the Justice Department's Criminal Division. This enforcement action demonstrates that the department will do everything in its power to protect the healthcare systems our communities rely on from people looking to defraud them for their own personal gain. The alleged schemes involved in the payment of illegal kickbacks and bribes by laboratory owners and operators. This was in exchange for the referral of patients by medical professionals working with dubious telemedicine and digital medical technology companies, and was the focus of the coordinated federal investigations announced. More than $1 billion of the total claimed intentional damages related to the current enforcement action are attributable to telemedicine schemes. Some of the nation's first prosecutions for bogus cardiovascular genetic testing are included in these accusations, which are part of a growing scam. Medical personnel allegedly referred patients for pricey and medically pointless genetic tests for cardiovascular disease and cancer, as well as durable medical equipment. Medicare does not approve the use of cardiovascular genetic testing as a general screening test for identifying an elevated risk of having cardiovascular diseases in the future, or as a technique of determining if a person had a heart condition at the time. Protecting the American people is at the forefront of the FBI's mission, said Assistant Director Luis Quesada of the FBI's Criminal Investigation Division. Fraudsters and scammers take advantage of telemedicine and use it as a platform to orchestrate their criminal schemes. This collaborative law enforcement action shows our dedication to investigating and bringing to justice those who look to exploit our U.S. healthcare system at the expense of patients. Today's enforcement action highlights our dedication to fighting healthcare fraud and investigating individuals who target Medicare beneficiaries and steal from taxpayers for personal gain, said Inspector General Christy A. Grimm of the U.S. Department of Health and Human Services. HHS OIG is proud to work alongside our law enforcement partners to disrupt fraud schemes that use the guise of telehealth to expand the reach of kickback schemes designed to cheat federally funded healthcare programs. In one example, the owner of several clinical laboratories was accused of participating in a plan to pay over $16 million in kickbacks to marketers, who then paid kickbacks to call centers and telemedicine firms in exchange for doctors' orders. According to court filings, the defendant and other exploited orders for genetic testing for cancer and cardiovascular disease to submit over $174 million in erroneous and fraudulent claims to Medicare. Nevertheless, the test results weren't used to treat patients. Through a convoluted web of bank accounts and other legal companies, the defendant is accused of using the money obtained through the fraudulent plan to pay for expensive cars, a yacht, and real estate. The accusation demands the loss of 3 residences, the yacht, a Tesla, and other cars, as well as more than $7 million in US dollars. A telemarketing network that deceived thousands of elderly and/or disabled patients into participating in a criminal enterprise is said to have been controlled by some of the defendants charged in this enforcement action. The network had domestic and international bases. In order to get Medicare beneficiaries to consent to cardiovascular genetic testing as well as other genetic tests and equipment, the proprietors of marketing businesses allegedly instructed telemarketers to utilize fraudulent methods. The Centers for Medicare and Medicaid Services continues to aggressively investigate fraud, waste, and abuse, and has taken action to protect patients, critical healthcare resources, and to prevent losses to the Medicare Trust Fund, said CMS Administrator Chiquita Brooks LaSure. Work like this to combat fraud, waste, and abuse in our federal programs would not be possible without the successful partnership of CMS, the Department of Justice, and the U.S. Department of Health and Human Services Office of Inspector General. According to the charges made public today, the telemedicine companies conspired to get doctors to order these pricey genetic tests and durable medical equipment whether or not the patients required them, and that these orders were made without consulting the patients or with only a brief phone call. Frequently, the patients were not given the findings of the tests or the durable medical equipment since it was useless to their primary care physicians. The announcement made today expands on earlier telemedicine enforcement actions that resulted in over $8 billion in fraud, such as Operation Brace Yourself in 2019, Operation Double Helix in 2019, Operation Rubber Stamp in 2020, and the telemedicine portion of the 2021 National Healthcare Fraud Enforcement Action. In particular, Operation Brace Yourself telemedicine and durable medical equipment takedown alone is thought to have saved Medicare more than $1.9 billion in the 20 months that followed the enforcement action on the cost of orthotic braces. Acting Principal Assistant Chief Jacob Foster, Acting Assistant Chief Rebecca Yuan, and Trial Attorney Catherine Wagner of the National Rapid Response Strike Force in the Criminal Division's Fraud Section oversaw and coordinated today's enforcement activities. The U.S. Attorney's offices for the District of New Jersey, Eastern District of Louisiana, Eastern District of Texas, Middle District of Florida, Middle District of Tennessee, Northern District of Georgia, Northern District of Mississippi, and Western District of North Carolina are pursuing prosecution through the Fraud Section's National Rapid Response Strike Force and the Healthcare Fraud Unit Strike Force in Brooklyn, Detroit, the Gulf Coast, Houston, Miami, and Newark. The operation included participation from the FBI, HHS OIG, CPI CMS, VA OIG, DCIS, IRS, MFCU, DEA, and other federal and state law enforcement organizations. And here we come to the end of today's episode of Fraud Files regarding 36 individuals who were charged by the Justice Department with $1.2 billion in healthcare fraud. Please subscribe to our channel and push on that like button. Stay tuned to our channel for amazing videos like this one by clicking the bell icon. And don't forget to share your thoughts in the comment section below about this event. We will see you in another Fraud Files soon.